Do you also know about the immunization for children in India? What are the facts? India's universal immunization program is a part of reproductive and child program under National Health Mission. It is one of the largest public health programs in the world under which vaccination is being provided free of cost to all the pregnant women and children. Vaccination can be availed against 12 vaccine preventable diseases, nationally against 11 diseases: diphtheria, pertussis, tetanus, polio, measles, rubella, severe form of childhood tuberculosis, rotavirus diarrhea, hepatitis B, meningitis, and pneumonia caused by Haemophilus influenza type B, and pneumococcal pneumonia, and subnationally against one disease which is Japanese encephalitis. The Indian Academy of Pediatrics Advisory Committee on Vaccines and Immunization Practices recommend immunization of children until the age of 18 years based on the recent evidence of licensed vaccines in the country. So today in this video we are going to learn about all the vaccinations which are in the schedule of India. Let's get started with what it is going to start. So we will be understanding all the details of the vaccination which is given at the birth, during the birth, and after till the 18 years of age. Starting from the birth at the month, that is during just after the birth, three vaccines are given, which is BCG, OPV, and HPV. Hepatitis, oral polio, and bacillus calmette-guerin. ठीक है, तो BCG, hepatitis, these are the vaccines which are given in the form of injections, and the polio is given in the form of oral drops. So this is all about the three vaccines which is given at the birth. Now we will talk about the 6 weeks, 10 weeks, and 14 weeks interval. Three dosages of OPV is given. Pentavalent, which is the combination of five vaccines, is given at the same interval of 6 weeks, 10 weeks, and 14 weeks, in which the OPV is oral and the pentavalent is in the form of injection. It's given in the anterolateral side of the mid thigh. Okay, so this is all about at the age of 6 weeks, for 10 weeks, and 14 weeks, three dosages of vaccines is given in the age. The pentavalent injection includes the diphtheria toxoid, IPV, and hepatitis B vaccination. And at the 10 weeks, rotavirus is also given, and 14 weeks rotavirus third dose is given. Rotavirus ki first dose is given at the age of 6 weeks, 10 weeks, and then 14 weeks, as you can see here in this image. Next is the pneumococcal conjugate vaccine, which is given at the age of 6 weeks followed by 14 weeks, and then the booster dose of the 9 to 12 months. Three dosages are given in the age. Inactivated polio vaccine is also given in the two fractional doses at 6 and 14 weeks of age, which is at the intradermal right upper arm. So this is not just the end of the vaccination. Even if the child is 14 weeks of age, there are more vaccinations to be given. So let's know about that vaccinations also, that is given after 14 weeks of age of the baby, of the infant. At the age of 15 months also, there is MMR vaccine which is given, measles, mumps, and rubella. And then next we will talk about the 16 to 24 months age gap में जो vaccination दिए जाते हैं, we will talk about that. Since till here we have read about the PCV, rotavirus, and IPV vaccine, which is this IPV is in the form of injection, but you should remember that OPV is in the form of oral drops. So OPV is oral and IPV is injection, and rotavirus is also the oral vaccination. Next we will learn that about the age of 24 months. Since many parents think that at the age of 24 the vaccination is finished, but it's not the case. Now you have a schedule to follow, which is till 16 years of age. So at the 16 to 24 months, there is diphtheria and OPV and Japanese encephalitis vaccination for the first time. So this is at the 16 to 24 months. Now at the age of 2 years there is only typhoid booster dose. At 5 years of age there is the diphtheria ka second dose is there. And at the age of 10 to 16 years, 10 years and then 16 years in between, also you can give the tetanus toxoid injection to prevent your child from the disorder which is tetanus. So yeah, till here we have discussed all the immunization that is present in the that is to be given to the children at this age, at the age from birth to 16 years of age. There is a follow routine. So at this point of time you are clear with the immunization schedule that is in the form of chart that I have just presented here. Remember that there is a 2 dose of measles, mumps, rubella at 9 and 15 months of age, and no standalone measles vaccine is given at 9 months.